Hi, I'm Josh Bixler, Clinic Director for KORT Sports Performance and Rehab. Today we're going to take you through the team approach of working with an athlete from injury to recovery. Come follow me. At KORT Physical Therapy, we work closely with Norton Sports Health to provide a systematic process working with athletes and patients from injury to recovery. In addition to working with Norton Sports Health, we also have the largest indoor training facility in the region, as well as on-site coordination with the leading strength conditioning staff. Today, I'm joined by Dr. Ryan Krupp, an orthopedic surgeon with Norton Sports Health, and our patient Aaron Rothfeller, a student athlete at South Home High School.
Well, thank you all for being with us today. So we have the fortune of having Aaron with us. He's one of our athletes who unfortunately suffered an injury on the field of play. But the good news is he came to see us, and we're in the process of getting him back on the road to recovery. So Aaron, tell us a little bit about kind of how your injury occurred.
So I was playing a game with my child ball, the Wolves, and I was getting a lead off, and the pitcher tried picking me off, and I slid back into first base, and I dislocated it, and I kind of fell back on my side afterwards, and I didn't really know what it was, but I got back up, I popped it back into place by myself, and then
so you kind of felt it kind of shift and then slide back in?
Yeah, and then 4 days, because I couldn't really get into hospitals or anything, so 4 days later, I woke up, I had dislocated it in my sleep, I had to go to the ER and get it put back in, and then I went to go see Krupp a couple days later.
So, you know, it's not uncommon. Sometimes you'll have instances where someone's shoulder will dislocate or have an instability episode, and they'll kind of feel this shifting of the shoulder, and it's really where the ball and socket slides. And so, you know, many times we'll try conservative care first and see how that goes. But when you have someone that has a follow-up instability episode, like sleeping, where it comes out so easily, there's a pretty good chance that's going to be a problem for him going forward. So when Aaron came in to see us, we tested him. So his range of motion, his strength were decreased. He was very apprehensive. So there's certain maneuvers we do that he didn't really want me to do very easily because he felt like it was going to slide out of the socket again. And so those are big red flags for us that probably something else was going on. There's more damage in there. So we went ahead and did an MRI. And so once we got the MRI back, we sat down with Aaron and his family, talked about what the images showed, how that related to his injury and the pathology or the damage that was in his shoulder. And so that we came up with a plan and took him to surgery. So that was about 7 or 8 weeks ago. And so we did what's called a labor repair with capsulorrhaphy. And that's just really a fancy way of saying we fixed the gasket ring around his socket, kind of back up on the face of the socket with sutures and anchors, and tightened up his capsule so that now the ball would sit more square on the center of the glenoid, kind of like a golf ball on a tee, and all the ligaments and the soft tissues around that area were retensioned appropriately. So he's going through the phase now of healing, working with our therapists, and then we'll progress forward on the road to recovery with the ultimate goal of getting him back on the field of play. So next, why don't we move in to the physical therapy component of this, and Josh and his team, and we'll kind of hand them off in the process here, which is exactly what happens on a daily basis with all of our athletes that come through Norton Sports Health. So Josh, is all yours.
So when Aaron first came to us, he was in a sling for 6 weeks. So early in the first 6 weeks, we need to make sure what Dr. Krupp did, we need to make sure that we don't disturb that and we allow it to heal properly. Now that he's out of this sling, we need to work on some shoulder reconditioning, but knowing that he's an athlete, we also need to work on his trunk and his legs to get him ready for what he's about to do out there. So a few exercises that we're working on currently with Aaron is a side plank with external rotation. So he's going to start to work the trunk muscles, hip muscles, as well as start to recondition that right shoulder. From there, he's going to make our way back over to here, Aaron. We want to work on some shoulder endurance for him with various different heights to fatigue him out that way. And there are different things where I can come in and I can put my hands on and challenge his shoulder at different heights there to work on his strength that way. We also want to work on his leg strength and his power. So Aaron's gonna get down into what we call a split squat. Safe for the shoulder, but still effectively works the hips and the legs. This is gonna start to address some of the things that he needs as he's working back to baseball. Like so. As he gets further out from surgery, we'll progress what we're doing in here as well as increase the resistance used with the ultimate goal of getting out to here and then back on the field. Next, I'm going to take Aaron out to Eric here, our strength conditioning coach. Here on our training facility, Eric Aaron.
Hi folks, welcome. Aaron, nice to meet you. So here at Norton Sports Performance, we like to continue care, right? So we went from a medical perspective all the way up into application, getting them back into sport. So with our 17,000 square foot facility, we can take care of any injury in relation with how the doctors at Norton Sport Health operate on them, into what goes on within their physical therapy, and how they're discharged into getting back into sports. So with our facility being so big, we have indoor space of speed and agility. We also have indoor space of strength training, so we can make sure that we get a holistic approach to how we rehab somebody back into sport. So if they're a sport athlete that is involved in running and they're a field sport, we can make sure that we take care of their energy system development. We can make sure that all their strength needs are met if they're a strength power sport like baseball or softball. So in a collaborative effect, we have everything pretty much under one roof here. So how we talk with docs, how we talk with our physical therapists, and how we ultimately end up talking back with mom and dad and the kid to get him back on the field is a collaborative effect. It's how we do things here at Norton Sports Performance in correlation with KORT and Norton Sport Health. So this is our facility. We offer everything under the sun, from adult fitness all the way down to sports performance, and then the big aspect, again, with the partnership with KORT and Norton Sport Health is the return to play program. If you have any questions about that, feel free to come on out. Right now, we're going to actually go back into the facility, into the clinic, and answer any questions you have. So, yeah.
Ask some questions, so thank you all for spending some time with us and answering those. Specifically for Dr. Krupp, can you discuss the importance of the Return to Sport Bridge program and the impact that it has on an athlete's ability to perform at the highest level following an injury and surgery?
Absolutely. You know, one of the things that, you know, as you see more and more athletes and you take care of more and more problems, there's that aspect where you do surgery or treat an injury, you've done physical therapy in the traditional setting, but there's a big gap between being kind of physical therapy on paper ready and actually game ready. And so, and that has a couple different components to it. And part of that is having, you know, a facility in a place where you can push an athlete, simulate game time situations, work on the appropriate dynamic stability, perform different maneuvers that you're going to need to do on a daily basis when you're playing a sport. And that can always be simulated in a traditional setting of therapy. The other part of that is, not only do you have to get them physically ready in a dynamic position, but you also have to get them mentally ready. And until they can go through that process multiple times, oftentimes in the back of their mind, even when they're structurally sound, they're thinking, is this going to happen again? And that's a big part of that process. And so that's where I see the big strength and power of that from a bridge perspective, is taking them, once again, from traditional medical, physical therapy, getting them ready so when we push them back on the field, we feel confident, and more importantly, they feel confident that they're ready to go.
As a parent of an athlete, what are the benefits of the collaboration between the surgeon and the physical therapist? Josh?
So the biggest thing, I think, is trust. So I know exactly on my end what Dr. Krupp's doing. I can relay the information to the patient, to the athlete, to the parents, kind of walk them through the process. And then on Dr. Krupp's end, I think, they can trust what we're gonna do here, right? So they know that I'm not gonna put the patient, the athlete in harm's way, that we're gonna progressively load them based on not only healing and surgical times, but also they know that they're gonna get a systematic approach, meaning that stepwise process, working them back to their sport. So the biggest thing is that collaboration. So we're not practicing in a silo. If you're in college, if you're at pro level, you've got the physicians, you've got the PTs, you have the athletic trainers, you have the strength coaches, all working together for the betterment of the athlete, and that's what we're able to provide here with the collaboration.
Eric, what can one expect as an athlete at this facility?
From a standpoint of bridge program, return to play, you're gonna get into a smaller group setting, which is very individualized based on what injury you present with and where you are at in your rehab. So at one point in time, we could have 3 ACLs out training with us at the same time, each at a different stage in rehab. And our coaches, our certified strength and conditioning coaches, are qualified enough and have the understanding not to work in that silo like Josh talked about, but to make it a collaborative effect that we know exactly where they're at from day one when they step out onto the turf from Josh's clinic to when we hand them off into the coach and say, all right, you are ready to go. Just like what Dr. Krupp said, that big gap is in there because on paper you're great, doc checks off, you've done all your physical therapy, but are you fit enough to go back into your sport? Are you ready and have you practiced the movements enough? All that stuff we do here in-house in collaboration with the medical side of it.
Dr. Krupp, from a surgeon standpoint, what impact does off-season training have on in-season performance and injury prevention?
I can't emphasize enough. People talk about, getting ready for sports. So there's really 2 aspects of that. One is the sports performance side. There is no doubt that, people talk about, he came out of nowhere. No, they didn't. He or she didn't come out of nowhere. There's a lot of hard work. Yes, there's God-given ability, but there's a lot of hard work that goes into that. And so you're not going to reach your peak performance if you're not putting that off-season training in motion. And that's, specific maneuvers, building all the other muscles that most of us ignore. It's building that core, that foundation. And then it's about repetition, okay? So that's from a sports performance side. But the second part of that, the part that's often ignored or overlooked, is the injury prevention side. So it's the same thing with that return to bridge program after an injury. It's the same thing in the off season where we're trying to prevent injuries when they come back to in season. And all of that is building upon that foundation so when you hit the ground running, literally, you're ready to go and at the top of your performance level.
I'm a busy parent with limited time and your clinic is not the closest. How is your approach different than anywhere else, Josh?
I would say, first and foremost, the best ability is availability. And you can't be on the field, you can't be practicing playing with your teammates if you're not healthy. So the biggest difference is really just the systematic approach. And what I mean by that is we have different phases of rehab laid out that are explained to you based on what we see with your exam. And we kind of say, in order for you to do this, we need to reach these certain performance indicators or goals. And this is how we're going to test you. In addition to having that process, we also have the space in the facility to effectively load you as an athlete, work you as an athlete, and we've got the technology and testing available. So our testing is unmatched in terms of what we're able to offer here, and that's going to give us not only good information about where you're at, but in the long run, if we are effectively able to work with you in a systematic approach, it's going to get you back to your sport quicker and safer, which in turn should save money for you and also kind of cut down on the time demands of coming to physical therapy.
As a surgeon, Dr. Krupp, do you have anything to add to that from a busy parent's perspective?
No, I think there's no doubt that time, is the greatest thing of value that we have. And I get that question asked all the time in the office when we're trying to find somewhere to go. They say, well, gosh, there's such and such facility or clinic is closer to me. And what I just reiterate is, many of us would say club sports, for instance. We all spend time driving to games and driving to fields and those type of things. And so that's what they have to look at, is look at it in the same vein as taking them to a big tournament, taking them to their practice at their facility. This is the core that's going to allow them to achieve at the level they want, and more importantly, stay on the field. And so that's really how you have to look at that. And once again, we're not talking forever when it comes to rehab. we're talking about making an investment in the time period that you're spending at the facility and knowing when I leave here, this was time well invested. And that's what you're going to get here.
One last question. Why do you think Norton Sports Performance is unique and the best choice in this region for rehab, sports performance, and training? All of you all can answer that in some respect.
Yeah, I think, from my perspective, when I started, we started kind of the Norton Orthopedic Institute, Norton Sports Health Program, as we're building, and you try to put all the pieces together. And one big piece that I thought was extremely important for the health and welfare of our athletes in the community, our weekend warriors in the community, and just general overall health was having a facility that was across the broad range of performance and health when it comes to sports and athletes in physical activity. And so what's unique here is you might have a piece here, or a facility here, or a person here that provides one part of that overall comprehensive program. There's no facility in this area or region that has from beginning to end, whether it be from the medical side and the access to all of the physicians and providers that we have within Norton Orthopedic Institute, whether it has from the rehab side with KORT, or from the sports performance side with Eric and his team. When you walk in the door of my office, this facility, there's no more comprehensive program available, with the facility available to achieve all those goals, no matter what perspective in that continuum you are. And that's extremely unique. And that's what we can provide.
I think that's all the questions we have for today. So you all would like to thank everyone for coming and viewing with us.
Thank you all for taking the time. Appreciate it. Come on out and see us.